Hello, and welcome to Simply Free Little Talk. And today is Health Matters with Dr. Kenya. I'm going to bring Dr. Kenya in, and she's going to share information with us concerning migraines or headaches. Hello, Dr. Kenya. How are you doing today?
I am so awesome, Free. It's great to see you again.
Good to see you as well. So, share with us the topic today are migraines or headaches.
Well, I tell you, migraines are just that, Free. They are a headache not only to my patients, but also to me sometimes.
Oh,
They can be
wow.
so tricky, very, very
Mm.
tricky. I mean, there's so many different types, Free. And I think that's where the initial part starts, is figuring out what type of migraine the person is having so that you know
Oh,
even where to start with it.
with the treatment plan.
Yes, it's all about coming up with the right plan and the patient being willing to basically pay attention. A lot of times they don't pay attention to their signs, to their symptoms, what they've eaten, what they've not eaten. And I know before we spoke about power over
Yeah.
diabetes, but today, with power over your migraines, whew, like I said, it is a headache.
So we can have power over our headaches.
We can learn to, we really can. And so, some of the things, like for instance, in understanding the types of migraines, okay, first off, we need to think about, well, what's the difference between a headache versus a migraine? So, a headache is something where it's just a bother. It's there. It doesn't make you sensitive to light. It's not making you sick. It usually goes away, when your stress goes away. Versus
Hmm.
a migraine is debilitating. A migraine makes it where you're light sensitive, you're sensitive to food, to smells, to sound. You may even have nausea and vomiting that's associated with it. And so these are going to be signs then of a migraine, at least a type of migraine. And the reason why I say it that way is because there's migraines with aura and there's migraines without aura. A migraine with aura is kind of cool because at least you get a premonition. Okay.
Hmm.
So you may get a certain smell that starts coming, or you may see squiggly lines in your vision. You may get a ringing or like a tingling over your face. And then within like 5 to 30 minutes, you will go into a full blown migraine. So we call that a migraine with aura.
A
Now,
migraine
get
with
this.
aura. Mm.
Now, check this out. This is where it starts getting complicated. There are some people who have ocular migraines. Okay, what in the world
Ocular?
is an ocular migraine?
Absolutely,
An
ma'am.
ocular right? An ocular migraine is where you get like blindness. You literally go blind for a
Wow.
period of time and then your vision comes right back. Would
Oh
that
my
not be
goodness.
scary?
Yeah, absolutely. I'm
So when it
taking notes
first
as always.
happened,
Wow. I'm amazed.
so okay, and then there's like what we call abdominal migraines. That's even more tricky because then, we talk about IBS versus, chronic constipation. How do you actually diagnose a gastric
Yes.
migraine?
Wow.
Okay. I am telling you, this
Okay.
stuff gets complicated, okay?
I
Then
see.
you've got you've got some people who have menstrual migraines. At least again, there again, you have a premonition. So as that person is getting close to having their cycle, they will have a migraine. And it only comes once a month.
Once a month
Okay.
headache.
Then I know, right? You've already got cramps and everything else. Now you got to have a migraine too. I
On
don't
top of
know.
that, wow.
So, on
Unbelievable.
top of that,
Unbelievable.
then
Hi,
you've got
Benita
some
Parsons.
people who,
Oh my
yeah,
goodness.
right now you've got up on our sign here that we're talking about
Yes.
power over diabetes. But as
Yes.
you know, we are talking about, to our audience who's just chiming in, we're talking about migraines, headaches versus migraines.
Oh,
And
well,
so
let's
then
correct that.
the
Let
other
me get
thing,
that.
okay,
I
while
guess
you're
I was
doing that,
stuck
I'll
on
be
the
telling people
diabetes,
about the
the headaches. Yes. Thank you for
mm-mm-mm.
noticing.
Now, for sure, diabetes can cause some headaches, right? If you got your sugars going
Yes,
up
it
and down and
can.
all of that, it sure can. Now, there's a very dangerous type of migraine, and that one is a complicated migraine. Okay, a
Complicated.
complicated migraine is yes. That is your migraine that looks and feels like a stroke. So
Wow.
literally, you may have half of your body or a part of your body go into paralysis or partial paralysis for a while. And for all intents and purposes, you dial 911 because you should be assuming that that is a stroke. Okay. Those are
Wow.
complicated migraines.
Complicated.
And in fact,
Mm.
that type of migraine puts you at higher risk for actually having a stroke.
Mm.
Okay. So, to our audience, I
Wow.
hope that you guys caught that. If you have been diagnosed with complicated migraines, then generally your physician is going to put you on a low dose aspirin
A low dose
because you
aspirin.
are at higher risk. You're at
Mm.
higher risk for having a stroke.
I
hmm
have a question for you. Well, it's a comment, and then I have a question regarding the comment. It says, migraines are nothing nice. I'm so blessed that God delivered me from those migraines. She says, hallelujah. And that's Benita Parson. My question is, and you somewhat answered it. You said call 911 immediately when it's a complicated stroke, a complicated headache that could lead to a stroke. That's so serious that a headache could that a headache could mimic a stroke.
Yes, a headache can. So a migraine can mimic a stroke. And again,
So a
once
headache
that
might mimic
diagnosis
a
is
stroke.
made, usually the person has gone to the emergency room and they've run all the tests. Okay. And then they figure out, oh, okay, this person is not indeed having a stroke. They're having a complicated migraine.
Wow.
And so that is then when we will refer the person on to a neurologist, and the neurologist will help to follow that patient. Okay. And generally,
Mm.
what they'll do is have that person placed on a low dose aspirin because in the future, it usually means that they're going to be at risk for an actual stroke.
Oh my goodness.
hmm Now, there's one other type of migraine that I've not spoken about. Actually, two others. One is a tension migraine. When you get that headache or that migraine that's just going on and on and on for days, and usually it feels like a band around the head,
Mm.
okay? And it feels like a tension. That is a tension migraine, okay?
Tension
And
migraine.
so
Wow.
those until the actual muscles are relaxed, those migraines are going to keep going. I don't care what medicine you take. They're not going to be able to make that headache go
Must
completely
relax.
away Yes. And so that's where
Mm,
you start seeing people being referred to pain medicine or to um, physiatrist,
mm.
okay? Because what they're going to have done generally are Botox injections to help
Well,
relax the muscles. These are people who also do really well with relaxation techniques. They need to be doing their
mm-hmm.
stretches. They may need to have a cervical traction device. Okay. So anything that can help them getting massages or what have you to keep those areas relaxed out. People who start having those types of migraines, the tension migraines, it's usually
Yeah.
because they have had years of
Mm,
collecting their stress in their neck and shoulders. Okay.
mm.
And so the muscles are tense all just deep in, it's not just superficial. Okay. So they have to try to retrain their muscles to relax.
Oh, wow. So
Okay. And then
training is
one other
required.
type. Oh yeah. Oh yeah. Our muscles, our yeah, it's kind of like riding a bike or playing an instrument. We teach our body to do things and then after a while it just
Yeah.
happens.
Hi, Minister Tanya.
So another type of migraine is called a cluster migraine. Cluster migraines are more common in men than women. Okay. It can still happen in women, but they're going to be more common
Mm,
in men. So that's where you maybe for a series
mm.
of 3 days just get this cluster of migraines.
Yes,
Okay.
yes.
And then gone as if nothing had happened, just gone.
Mm.
All right.
Just gone.
That type of migraine, the person will usually have it in one side of their face.
Mm-hmm.
Usually they'll get tearing from one eye. They may even get redness of that eye. They even may even get a runny nose on that side. Okay. That type of migraine, the cluster migraine, actually responds best to oxygen. We
Best
have
to
learned that we can, I
ah,
kid you not, we can prescribe the person oxygen and they
wow.
use it when they're having their cluster migraine and it will go away.
Let me ask a question concerning the oxygen.
Mhm.
What is that about oxygen? That is it because it's releasing the oxygen to the
Girl,
brain?
you're going to have a neurologist do a follow-up,
Oh,
okay?
follow up
So
on that. I was like,
I
okay.
seriously do not know the whole mechanism to that, nor why it's only
Oxygen.
affecting one half of the
Wow.
body. But Free, it would be awesome for you to have a follow-up
Yes.
conversation on health matters with a
Wow.
neurologist, okay?
I would
Because
love
they
that.
can
I
get
know
at
some.
the how this mechanism happens,
Yes,
okay?
yes.
So
Wow.
now those are all the different types of migraines. Okay. And we talked a little bit about the difference between those. Does the audience have any questions about those?
Any question, audience, just type it in so that Dr. Kenya can address them. And if we've addressed something that was a question, would she address my question that I had regarding the type of migraines and what the treatment plans are? So that's good for me. But there's others that say how excruciating the pain is. But you said in regards to men, that they're more prone to endure the pain of a cluster migraine headache. And I personally experienced that with a gentleman in my life that had dealt with them. And you said oxygen. There was a certain prescription that was given, and I don't know what that was because I don't recall, but that's what they were given to change the outcome of these cluster migraine headaches. But that's interesting that oxygen can be used for them. That was very informative. So thank you. Just
Yeah,
waiting to
yeah,
see if anyone
absolutely.
has anything that's on the line. You're free to type in your question. Dr. King, you would just want to know some things concerning uh, what do you know, your experience with headaches. Thank you, Miss Kiki, for coming on. I'm telling you guys, if you have any questions concerning headaches, and okay, yes, Miss Tanya says, yes, my migraines have me with a lot of pressure on the top of my brain. So she's experiencing on the top of her brain the pain. So she wanted to say, I guess the top, Tanya, was that a question you had? Hi, Greg. Did you have any type of questions regarding the brain, the pressure that you feel, Tanya? Okay, we'll see if she's going to respond to that. But you've covered a
Okay,
lot. While
well,
we're
while
waiting on
she's doing,
Go ahead.
yeah, I also wanted to talk about the class of medications. Okay,
Oh,
so
definitely.
we
Yes.
talk.
Think about the medication. Yes.
Okay, so we talk about classes of medications in terms of abortants versus preventive. Okay, so abortants are going to be medications that you just use sometimes. You use them when you feel that migraine about to come on. You take it, and then generally within 15 to 30 minutes, it's gone. If not, then within an hour, you can take another dose. I'll give you some examples. Maxalt, Imitrex, Sumatriptan, Zomig, okay? These are all different types of
Yes.
abortant. You take it and you hopefully can keep the migraine from coming on, okay?
Okay. I like that.
Then, within that class, there's going to be some that you can take as a tablet. There's going to be others that you can take and it will dissolve in the mouth. There's also going to be those that you can spray in your nose. And then there's also ones that you can inject into your thigh. Now,
wow, I've
the
never heard
ones that the ones that act the fastest are going to be the injectable, the nasal spray. Those are the fastest. Okay. Usually you will get a response within 5 to 15 minutes.
I like the response
With the
time.
tongue, exactly. With the tongue, usually you'll get a response within 30 minutes. With the swallowing, that's usually going to be an hour to 2 hours.
Wow,
Okay.
we've covered a lot.
So that's ones for trying to prevent the migraine from coming on. A lot of times people will wait too long before taking that. Okay.
I'm the
It
guilty
really
boy.
works best if you get it right at the beginning. Okay.
Yes. Okay. Y'all hear that?
Now,
Take your meds at the beginning. Don't wait like me.
unfortunately, there's some people who they can't even take that class of medicine at all. And it's because they have a heart problem. So people who have heart problems, or if their blood pressure is really hard to control, we don't give them that type of medicine because it can cause other problems. Okay, cardiovascular problems.
Wow.
Now, there's another class. So we talked about the preventatives, okay? In the preventatives, we've got beta blockers. That's a class. We have ACE inhibitors. We have ARBs. Those two you really should be familiar with from our diabetes discussion, or any of you guys who have diabetes, okay? Anybody who's had a heart attack is likely familiar with the beta blockers.
Yes, beta
And then
blockers.
there's also the calcium channel blockers. Those are the main classes of blood pressure medicines that can help with migraines. Okay,
Wow.
outside. So if I've got a patient who has hypertension and migraines, I'm going to go for one of those 4 types of preventatives. You see how that works? Okay. Now, there's also, go ahead. Is there a question?
You had 2 comments. Miss Parsons says, as they stress, they feel that they what is it, a bit, a whole bit, or a lot? They have the headaches. I guess there's a result of stress. And then Mr. Gregville said that he had the beta blocker before. And Tonya says the ApiPen that she uses is for her migraines. So people are
Yep.
just making comments in regards to the information that you provided. So thank you. And thank you,
Yes,
audience.
yes, you are very welcome.
Thank you,
So that
audience.
was our blood pressures. Okay. Then there's another class, and those are anti-seizure medicines.
Anti-seizure.
So things like topiramate or gabapentin, carbamazepine,
Mm,
Tegretol, um, all of those are types of anti-seizure medicines. So sometimes people, they're given that and they look at it and they're like, whoa, but doc, this says
mm,
that this is for seizures. Am I having seizures? No, you're not having seizures, but we do need to calm the brain down.
yeah.
Okay.
Stay
And
calm. Yes.
so, yeah, so
Wow.
we'll generally reach for the anti-seizure kind with people who are having like mini migraines in a month, like over half their month is
Mm,
involved in some form of either a full migraine or a partial migraine. And
that's
so that
interesting.
is,
Partial. Mm-hmm.
yeah,
Partial
yeah.
migraine.
And so it's a little bit more rigorous of a treatment. So that's how
Mm,
we generally start thinking about which medicine to use when we're treating our migraineurs. So hopefully that helps our audience. Now, within that class of migraine medicines, there's one that has particularly come to the front as being a quick option, and that is the topiramate.
so
We
pyramid.
reach topiramate and gabapentin for any of you guys who have chronic pain also. So like outside of your
Pain.
headaches, maybe you've got chronic back pain, maybe you've got paresthesias from diabetic neuropathy or some other nerve problem. We tend
Mhm.
to reach for gabapentin or topiramate because those two are especially good for pain control as well as for migraine prevention.
For migraine.
Topiramate, mhm, topiramate, in particular, you've got to, it's the best way. You have to drink a lot of water with that one because it can
Mhm.
make you dehydrated. And so, if you're susceptible to getting kidney stones, we try to avoid that in patients who have gout or who have had kidney stones. Now, I've had some people come to me free,
Mm.
always women, never had a man ask this ever. I
Ever.
have women come to me and say, "Will you put me on topiramate?" And I'm like, "Why? Okay, we haven't even
Wow.
tried any of the first stuff yet." It's because they've heard that it is a good appetite suppressant. This is
Oh,
true.
I
It
was
does
wondering
cause
why.
weight loss.
Okay.
Yes. It is touted for helping with weight loss. Okay. But that would not be the reason why you should choose that as your first choice. Okay. So if you're, you can bring it up to your physician, but definitely be open to hearing the different reasons why they're reaching for particular classes of medications with you. Gabapentin, on the other hand, some patients try to steer away from because it can cause weight gain.
Hmm.
Okay. Any other questions that the group has?
I haven't seen a question yet on any of the meters, but what I am placing in, and you can actually concur with me, I am typing in a disclaimer that you are not anyone's primary care physician, including Free Little, and that they are to seek advice from their own physician.
Yes, for sure. And you guys, if your physician doesn't seem to be getting anywhere with your diagnosis, just ask for a referral to a neurologist. it can really be hard getting to the bottom line of what's triggering the migraines and what type of migraine the person has and the best treatment options. And so sometimes it is going to take a team. You've heard me talk now about primary care. I've also mentioned neurologists. I've mentioned pain medicine. I've also mentioned physical medicine and rehab. Those are all different classes of physicians that
Yes.
help with controlling people's migraines.
I love the fact that there's a method or methods in place for preventative migraines, for also maintenance of the migraines. So that's a process.
Hmm. Hmm.
Is that
Most definitely.
Miriam? Is that a medication?
Now,
Miss Parsons said she said she was on Medrin, Midarin. Am I pronouncing that correct?
mhm,
Okay, I just want to make sure.
mhm, mhm.
Yes.
Yeah, that one's a tried and true. Usually, um, that's been around for a long time, okay? A very
Oh,
long time. So it's tried, it's true. It's not, it doesn't always work for everybody, okay? So those are usually ones that we use early in treatment courses. And if it's not working, then you progress on to some of those others that I was speaking of.
so it is one of the many, as we stated previously, it is one of the treatments. This is very interesting information. I've never, and I'm sure some of the audience has never really been explained to in depth as you have, as a type of migraines and a type of medication and the treatment plan. So continue. I'm sure there's more information that you have for us.
I do. I do. Okay, so now, how do you talk to your physician about your headaches, okay, or your migraines? There's
Yes.
information that if you go into your physician with some of these descriptions, you're going to be able to help them to decide on a treatment path, and then they will walk through a differential with you. So, what do I mean by that? You could actually go on your iPhone and download various apps for tracking your headaches. And with those apps, they usually will say on a scale of 1 to 10, how painful is your
Yes.
headache? It's going to ask, did you have to miss uh, for debility questions? Okay. Is it making you miss school? Has it
Really
made you stay home from work? How
good.
long does it last? What did you eat within the past 24 hours? What did you drink within the past 24 hours? What were you exposed to before your headache came on? If people can start keeping a diary of that, it would very much help. So, for my patients who come in and they're able to either on a calendar that they've been writing on or on their app that they've downloaded,
Hmm.
when they can show me that, that helps me to know if they need a preventative.
Okay.
And then it helps me to also start thinking about things that are triggering the migraine. So,
That's
for the
good.
audience that's out there, those are the types of things you need to be speaking to your physician about, sharing information with them on, and then read. You must read. Read on all the different types of things that can trigger migraines. Is it smell for you? Is it certain types of food? Like for some people, it's fermented foods. Um, all different. Some people, it's dyes. Okay. So you really have to be paying attention to a number of different things. Also,
Yes.
sometimes it runs in people's families. So talk to your relatives
Interesting.
to find
Interesting.
out, what
Hereditary.
their triggers were. Yes, or what their triggers were, what has worked for them. Something else that I want to say, free and people trying to think
Mhm.
about their headaches. Generally, migraineurs start around adolescence.
Okay.
Okay, generally. So if I
Wow.
get somebody who later in life is having headaches and they weren't having them in their younger days, I need to start thinking. I need to start thinking to
Wow.
myself, okay, do they have a mass that's
Yes.
growing in their brain?
Oh,
Okay.
that's something to
Did
consider.
they have head trauma? Yes. Have they
Yes.
had head trauma? Have they had repeated head trauma? Do they have a new exposure that is causing them problems? Do you see where I'm going? So
Yes.
a person doesn't just all of a sudden start having frequent headaches that then progress into migraines. That's generally not the case. Usually, it's been something that's been building since adolescence.
Okay. Well, I've been trying to answer some of the questions that the individuals had that I did know the answer to. Like, can you go ahead and verbalize it? I've placed it in the feed as to what is your current position you hold at UT Health, and how do you know anything about myositis? No, that's not the sciatic nerve she asked about. She was from the neurologist
Probably
named Yes.
myofascial. Is she talking about myofascial
It's
syndromes?
the weakening of the muscles, or that it's abusing itself. The muscles are fighting back. It's myositis.
Oh, myositis. Okay,
Myositis.
inflammation
Yeah.
of the muscles.
Inflammation.
Got it,
Yes.
got it, got it.
Yes.
So, yes, I am a primary care physician, which
Mhm.
specifically, I am a family medicine physician. Okay. So that means that I take care of people from birth until the time they pass. So it's my job to be able to know a little bit about many, many, many different conditions, and then know when to refer on to these various specialists, which is why I keep trying to remind you guys of what these various types of specialists are, their titles, and what they can help you with. Now, myositis, that's a whole different beast. That generally has nothing to do with migraines. That is an attack of the muscles or inflammation
Mhm.
of the muscles. And the word myositis is really more so a symptom, okay? And it generally points to there being a larger problem. Okay.
Mhm.
Now, there is something called myofascial syndromes, and that's where the type of, it's really just dealing again with tension, okay,
Mhm.
where your muscles and the fascia aren't moving freely past one another, maybe because of trauma that has happened to you in your life, or because you're just so tense. Okay.
Mhm.
And so that ends up with myofascial syndromes, and those are treated best with deep tissue massages. Okay.
Mhm.
I mean, those are the type of massages that hurt.
Mm.
But after a while, you're
Not
like,
so
okay, I'm glad you made me cry. I feel better.
Oh, wow. I had someone that wanted to know how to reach you by email. So it's on the flyer, but I'm going to go ahead and type it in. So that's the only thing now that I am doing. I'm actually trying to save some time by putting in the information and the questions to you.
That's okay. So, for those of you who are trying to reach out to me, that's all fine. Know that I cannot give you direct medical advice unless you come and
Mhm.
establish care here at the University of Texas Health in Jacksonville, Texas. I'd be more than happy to receive you and help care for you. Otherwise, I would say, please find a primary care that's close to you. Don't assume that what you are experiencing, um, is just normal for you, no,
Mhm.
you don't have to be miserable. Okay. Talk to
Yes.
your primary care provider, or get a primary care provider so that they can start working on this path of helping you. And go in with the information that I just taught you. Okay. What did we
Absolutely.
talk about? We talked about intensity. We talked about the number of days. We talked about what the potential triggers were: smell, food, okay, beverages. So these are all things that you need to be thinking about. How old were you when you started having intense headaches? Generally, migraines start when? Adolescence. Yes.
Adolescents, yes, you did make that very clear. So I'm just typing in different areas so that they would know how to contact you. It is on your flyer, and I did include the disclaimer that you are not anyone, including myself, Free Little, general practitioner. I have my own, but you're here to provide us with general information because you have access, because you are a primary care physician at UT Health in Jacksonville, Texas. And we're glad to
That
have
is
you here
right.
on Free Little Talk. Yes, we're very glad to have her. It's an honor that you care enough about people, that you're taking the time with these various topics that you have so with deep information provided for us. So I want to remind them what you stated again, and we have received at least 12, I think, at this point, of type of diagnosis that people would like you to speak on. So if there is something in particular that you would like her to address, please put it in the comments and I will forward them to her. But also, you have the liberty to send her an email. Thank you.
Thank you. Thank
You're
you, Free.
welcome. HD. If there's not, I mean, if you had any other things with the migraines, I'm just putting in your information in another site that you can speak
No,
on.
really, those were the main things, is that people have to empower themselves. They've got to track that information, and they need to read up on triggers for migraines, because then they'll really start paying attention to what they're putting in their mouth or surrounding themselves with. For some people, it's the type of lighting. Fluorescent lights are horrible for a lot of migraineurs. And so simply
Mm,
changing the lighting where you study or do the most work can help. Also, for some people, if they're not at liberty to make that type of change, they'll get these tinted glasses that
mm,
have like a type of it's a bit of a orangish hue to it, and it helps with cutting down that fluorescence. Also,
yes.
there's lighting on your screen terminals that you can have uploaded, and that also works well for migraineurs. Even simple vitamins like magnesium for some people,
Mm,
um, take if they're if a physician is always going to need to do some blood work first, okay,
okay.
so that they can figure out, are you iron deficient? Okay. Some people walk around not drinking enough water.
Hmm.
Water, if you're not getting it, those are usually headaches. But in the person who is tending to have migraines, it can trigger a migraine too, because the brain is dehydrated. Do you
Okay.
follow? Okay.
Yes.
So there's simple things. There's nutrition, there's hydration, there's rest. These are all things that our body needs to be healthy.
So water is crucially important.
Oh
Crucial.
yes.
It's a
Oh
must.
yes.
Because
Oh yeah. And everybody knows it. They know it. They just
yeah,
don't drink enough
we
of it.
know we just
They
don't
think
do
they can
it.
drink their soda. They think they can drink their soda, or they think that they can
Wow.
have their Kool-Aid. You can't
Wow,
replace it, you guys. You got to
you've
get your
actually answered a
water.
lot, Dr. Kenya. You've answered a lot about, and I love that you're making light of we're bad as patients and you're the doctor. So you see this in the primary care field, general medicine, where people are able to come to you with any type of illness. But I love the way that you give um, acknowledgement to your colleagues in various other areas, like the neurologist needs to be seen for certain things. There's a lady, Tammy Walker, said she's been dealing with migraines for over 30 years and she's had several treatments. And then Miss Morgan said again, thank you so much for all the valuable information. And as you were speaking, because questions were coming in, I was trying to address those. That yes, she's a primary care physician. She is there at UT Health in Jacksonville, Texas. And I love what you said.
Yes.
I am not your primary care physician. I did the disclaimer. We also want to add that yes, you're free to email her, but she cannot give you medical advice. But you're free to come to Health, and that would be good. I would love to have you as my doctor as well, if I was closer in the area.
Yes, please, you guys, don't be
Yeah,
driving.
it's
You
in the
know,
comments.
you literally, you
Lakia,
people,
it's in
you
the
guys
comments.
should be within. It's very important that you not have
You're
barriers
welcome.
to your care.
You're
All
welcome.
right. And so distance can be a barrier. So you want to make sure that you're always within 10, not more than 20 miles of your primary care. That's the goal.
That's good.
Okay. That is the goal.
I'm telling the ladies, thank you for their questions, and the questions that they had. We put them in the bot, we put them in the information. And so I've also included these individuals that had the questions, like where's your email? I typed it in, but I also wanted to attach the flyer so that they can see exactly where you are. Most definitely, please move to Houston and Galveston. They would like you to uproot and move to the Houston and Galveston area.
Don't worry. There's more of me. There's some others that are down there that will be able to give you really good help.
Yes. So let me share
really
this
good
with
help.
Miss Tanya. She's asking again about, did you know anything about MS? And I of course share with her that you do. But what we'll do, because we don't want to talk about another topic when we are on the migraines and headaches. But what we will do is we will add that to the list of other diagnoses that people have shared with us that they have received that they would like to hear more about. So MS will be added to that list as well. So thank you guys so much.
Excellent.
Move to San Francisco. Miss Tammy Walker say, move to San Francisco so you can treat her. Now UT Health is going to be with y'all. Y'all are trying to remove her from UT Health in Jacksonville, Texas. That we are so honored that you guys are supporting Simply Free Little Talk, and we're bringing great, positive, valuable information by way of Dr. Kenya. So thank you so much, always for what you bring to the show. We've learned so much.
You are so welcome. You are so welcome. And I look forward to speaking to you guys all again next Sunday at 3:00,
Yes.
right, Miss Free?
That's correct.
Miss Free Little?
3 p.m. Thank you. So I'm going to release Dr. Kenya. She's been amazing. She's given us her time on a Sunday at 3. We love it. And she's willing to come back again next week. We don't know yet. We'll see. She'll tell me this week what the topic will be, because y'all provided some good information on MS and other illnesses that was listed. So we'll make that decision and we'll let you guys know. So tune in. So Dr. Kenya, I'm gonna let you go and then say goodbye to everyone who was so kind to share their time with us today. Thank you, Dr. Kenya, for all the information. Miss Walker still wants you to move to San Francisco.
No problem.
Thank you so much. That's too funny. She's laughing at you guys. Thank you again, the beautiful, faithful audience of Simply Free Little Talk. Thank you. We're bringing you some valuable information for health. Health matters is very important and it's very near and dear to my heart. That's why you will receive this information at 3 p.m. every Sunday. Great topics. We do encourage you. Use the email address that I shared with you. Also, you can inbox myself. You can inbox me at any of the social medias and just share this topic I would like Dr. Kenya to address. and we will get to each topic that has been already sent to us. Thank you again. Thank you for tuning in. Look forward to 3 p.m. next Sunday. Dr. Kenya will have some great information for you. Thank you.